Good afternoon or good evening, wherever you may be. I am Dr. Susan Sanchez Casal, the Director of Tufts in Madrid. On behalf of the Office of Global Education and our co-sponsor for today's panel, the Fletcher School's Global One Health Diplomacy Initiative, I welcome the first critical thinkers. Thank you. This series of talks will present wide-ranging perspectives on compelling contemporary issues. Our intention is to offer a platform for ways of thinking and doing around the world that represent diverse human collectives and that challenge and expand how we see the world that we share. Today's panel, the COVID-19 vaccine in the global North and global South, ethics, access, resistance, will feature speakers Karsten Noko, who's joining us today from Johannesburg, South Africa, and Dr. Josep Lobera from Madrid, Spain, and will be moderated by Dr. Peter Levine from Medford, Massachusetts. Our moderator, Dr. Levine, is the Associate Dean of Academic Affairs and Lincoln Professor of Citizenship and Public Affairs in the Jonathan Tisch College of Civic Life at Tufts University. He is a moral and political philosopher whose research includes civic education, social movements, and the measurement of social capital. Dr. Levine co-leads the university-wide research group on equity in health, wealth, and civic engagement, and is the author of numerous books, including What Should We Do? Political Theory with Citizens at the Center, forthcoming from Oxford University Press. Peter, thank you so much for serving as today's moderator, and I will now turn the panel over to you.
Thanks for having me, and thanks everyone for joining us wherever you are in the world and whatever time of day it is where you are. I don't have expertise on this topic, so I'm just the moderator. I have some questions if we need them, though there'll also be space for everyone to pose questions. But my first pleasure is to introduce our two speakers. I think I'll introduce them together right away just for efficiency, and then it'll be Karsten who speaks first and then Josep second. So Karsten Noko is a lawyer, Zimbabwean, very interested especially in public law. He's been not just although he is a writer and thinker, he's also been a humanitarian aid practitioner for the past decade in several countries in Africa and Asia with Médecins Sans Frontières, Doctor Without Borders. He's particularly interested in health policy and how it intersects with the law. You'll hear about that. And he's been writing about what he's going to be talking about, which is medical colonialism and critiquing policies set by authorities at different levels in different countries globally to combat COVID-19, critiquing those policies. So thanks for joining us, Karsten. Josep Lobera is a professor of sociology at the Autónoma, the Autonomous University of Madrid, and in Tufts University's international program. And he's currently part of the group that's of experts that's designing the vaccination strategy against COVID-19 for the government of Spain. He's an academic, a busy academic, scientific editor of the biennial National Report on Social Perception of Science and Technology in Spain, that's a journal, and editor of the Spanish Journal of Sociology. He studies public opinion, political attitudes, social representations of science and technology, and he's been writing busily in many journals, including Social Science and Medicine, Information, Communication and Society, Health Communications, and others. So two perspectives, one from the global North, one from the global South, both, of course, aware of the rest of the world, both very learned and also on the ground, aware of what's actually going on. And so we're very glad to have you both. And I'm going to turn things over first to Karsten, then to Josep, then I do have questions ready, but please, everybody be thinking about questions you would like to ask, because that would actually be better. Karsten.
Thank you, Peter. Thank you for the introduction. And I wish I could claim to be an expert on this, but I will just try to offer some thoughts and reflections on the subject. So, of course, the question is on ethics and access. And I think that for me, at least from my perspective, it is very important that from the word go, we realize that when you talk about access to healthcare or access to vaccines in this particular instance, we are talking about an ethical issue. It is not possible to separate the two issues. But yes, I will try and speak to both of them. So probably the first question, which is a bit of a rhetoric question, is really, is there a point in discussing ethical issues with regards to access to healthcare? What is the point? Because I ask this because there's nothing new in this. So yes, the pandemic is new to us, but access to healthcare and access to vaccines is nothing new in that sense. And these questions have been raised before, and I think it's very important that we start from that recognition. So we know that already the big pharmaceutical companies who have been at the forefront of researching and developing vaccines for COVID are set to profit well over $60 billion in the next 3 years. And yet we have today a huge demand, or a huge unmet demand of vaccines, and the mechanism that we have today, which is the pharmaceutical companies who are researching and developing vaccines, are not able to meet this demand, not by a long shot. And speaking about this, I will try to. I did not prepare any PowerPoint presentation, but what I will try to do is share a simple collection of some screenshots that I've been doing in the past few days and weeks. And so, interestingly, when we talk about access to vaccines, so we do know that already there is research that indicates that if any part of the world, and in this particular situation, it is the poorer parts of the world, or the low-income countries, if they're not able to access vaccines, the impact will be felt by the whole globe. So as we try to think about the profit-making and the system, the development and the manufacture of vaccines that we have to also put this into consideration, because essentially what this means is that the effort that we've been putting as a globe to try to control the pandemic potentially will not achieve as much results as it could have if access had been much more equitable than it is today. So you have the people who produce or who research vaccines. They, when it's time to do research and development, of course, we have learnt about clinical trials being done in many parts of the world. And in South Africa, at least at the moment, one of the most topical issues is the fact that when it was time to research and do clinical trials, there were people in South Africa who volunteered to be part of the clinical trials. But unfortunately, as a country, when it is time to, when the vaccine has been passed and is available for use, unfortunately, these people are not, do not have access to the vaccine. So there is a question, an ethical question to be asked when you have a situation when it's time for tests, a scientific experimentation, people are asked to come forward, and they do come forward to participate in this, knowing, of course, the risk that goes with this. And then when the product is actually available, it is not accessible to them. And it's nothing new really to COVID-19, as I was saying earlier on. We have seen the same pattern replicated, whether we talk about Ebola, whether we talk about tuberculosis, whether we talk about, new vaccines for pneumonia and so on. So it's a recurrent theme, and it's nothing new in that sense. And unfortunately, at a time, and I think that Josep will speak to this later on, at a time when we are trying to get as many people to have trust and confidence in the healthcare system and in vaccines, unfortunately, this has the opposite effect on the people who we are expecting to take part in this. So we have, again, some questions to ask ourselves. And I think we cannot really, as I was saying, divorce the whole questions from the bigger package of access to healthcare. It has been decades, at the very least, when we first spoke about universal healthcare access. And at the moment, we know that many people in many parts of the world still do not have access to healthcare. And I'm talking about primary healthcare here. And we have let this go on. And suddenly, in the face of a pandemic, the impact of this, of course, is suddenly much more explosive, and it stares at us in the face. And one can only hope that after the pandemic is under control, we can go back to these questions, because when we speak and when you have these discussions in the middle of the pandemic, of course, the matters are topical, but we don't have the brain space to actually work on things that can potentially produce results in a few years. And finally, on the ethical issues that I want to speak about is the question of cost. So of course, we do know that whenever a vaccine is developed, there is an issue of cost involved. Someone has to pay for the research, someone has to pay for the development, someone has to pay for the production. And I really like the screenshots on Ukraine that we see on the presentation, because it speaks exactly to this, that we have a system today that we are not able to know how much a vaccine costs. All the information that we have is what we get from the manufacturers themselves. There's nothing that is transparent and that allows any other person to actually take a look at the figures. It is interesting, of course, that different countries are being made or compelled to sign non-disclosure agreements that forbid them from sharing this information as clients or as countries with other governments in their regions, but also quite interestingly within the government themselves. So you have a situation where the legislative branch of government is not able to exercise its constitutional responsibility to have oversight over the executive, because they are not, the executive is by law not allowed to share the details and the pricing of vaccines. And of course, we can only imagine that this kind of scenario is not going to be unique to COVID-19. So it's not only vaccines that will be already hidden. We have for a very long time, been talking about transparency and public funding in many countries, at least in my own country. And suddenly when you have this situation that encourages or rather compels people to hide this information on public expenditure, you can only imagine what the impact will be down the road. So we have to think about the impact of COVID-19 and what we are doing today on the future of public accountability and how we continue to hold governments to account on public expenditure. And then maybe just quickly to talk about access. I think what my point of departure on access really is that the pandemic has brought to a global recognition how broken the system of vaccines and medicine supply is. Many people, of course, who are not working in the space did not have an appreciation of just how broken it is. It was quite interesting to note, I think it was 2 days ago, when the European Union finally that actually the pharmaceutical company that was supposed to be supplying them with vaccines suddenly is not able to meet with the demand, or at least with the contractual obligations that they had. And suddenly they're making a lot of noise about it, as they should. But of course, they should have been making the noise long back, because it's not, as I was saying, it's not just unique to the COVID-19 vaccine. So we have some questions to think about. And we have to reflect on the question that it cannot be that a system is suddenly broken or should be expected to account because a certain particular group of people are denied access to, or rather do not have access to a vaccine. So we should be able to separate the issues and actually look at the issues holistically, because it's not, as we have seen, it's not possible to talk about a pandemic or an epidemic in China as it started back then and think that the rest of the world will be safe. We saw it in Ebola, we saw it now in COVID. And so I think that as the space between us continues to shrink, we should expect that epidemics will continue to spiral out of control. And we should be thinking about how do we contain the next epidemic to prevent it from becoming a pandemic. So I think we have some reflections to have there. And then finally, to talk about the role of intellectual property rights, because as someone with a legal background, I am interested in the questions of patent and protection of intellectual property rights. And this at the moment is the reason why the rollout of the vaccine or the production of the vaccine cannot be ramped up to meet the need, because the people who developed claim protection of their patents, and they want to ensure that these are not shared with anyone who is able to produce at a faster rate. So what we need to think about really is, how do we ensure that for public goods, such as vaccines, such as medicines, and it's not only medicines and vaccines that are public goods, but we see it across many other sectors, where suddenly these goods that are needed and not wanted, but I make the distinction between the word want and need, that are needed by people for their own health, are not protected by patents that put profits before the lives of people who need access to them. So I think we already have the Doha Declaration from 2004, but we continue to see how when the chips are down, the big pharmaceutical companies will always want to protect their patents. They will want to ensure that their profits are guaranteed, and whatever expense that comes with that is a secondary issue. So I think we should have that reflection as well. On the slide now, I put an interesting picture that shows that people in some parts of the world will only be able to receive the vaccine, at least the countries that are eligible for COVAX will only be able to receive the vaccine much later than other people. So we are looking at a timeline that even stretches up to 2024. And you can only imagine how often, how many times the virus will have mutated by then. And of course, we cannot not ask the question if the vaccine that we have will still be effective by then, if the virus has mutated so many times. So it is quite a stuck picture, so to speak, but it does show the impact of the inequality or the lack of access and how inequitable it is. Because when you see that the people who start to receive the vaccine are actually from one part of the world, and then you have the bulk of another part of the world not being able to receive the vaccine for up to 3 more years after that, I don't think that it is acceptable in a pandemic. Maybe just to share the last slide, again, speaking about access, I saw this, I think from 2 days ago, how Pfizer, the pharmaceutical company, says they can only guarantee that by the end of 2022, only 2% of their vaccines will have gone to the COVAX facility. And it's a facility that, unfortunately, as of today, the very many low-income countries are actually relying on this facility to supply them with vaccines. So it's not surprising then that probably actually 2024 in that sense is quite optimistic. If only 2% will be available to the COVAX facility by the end of 2022, we're probably going to take much longer before we get a global coverage, or at least a population immunity, if we can call it that. I think I will stop here for now, and then I'm happy to take questions later on, as you see fit, Peter. Thank you so much.
That's great. I mean, that's hard. You delivered some hard news there, but thank you very much for doing that. Very well done. So, Josep, if we can catch you next.
Thank you very much.
I think Karsten will have to stop sharing and give you a chance to share.
Yeah. Yeah, thank you very much for inviting me to this discussion. It's a pleasure to share with you some reflections. I will share with you this presentation. I think you can see it now. And I will be centered on the case of Spain, which I know the most, and I hope it can be representative for some other countries in the global north, and then be able to engage with you in some discussion afterwards. I will focus in three aspects. First, in concerns about the COVID-19 vaccine hesitancy, and also the social effect of misinformation, and then some reflections on my experience in participating in the design of the Spanish strategy for vaccination. As a sociologist, I'm very much interested in social trust, in political and scientific institutions. And when the pandemic started, we already had some work done on vaccination hesitancy as a main concern in some countries, as Spain, and we produced some data that I want to present you, and we observe, I think, quite interesting observations here. In July, we have these three-thirds in the public opinion in Spain. We had 1/3 which is very much willing to take the vaccination right away when available, and a second third which is with a strong negative attitudes towards vaccination, and in the middle third which is more hesitant about it. And we observed that after the protest in Spain and in other countries in Europe, I don't know if you remember, during the summer, we have very much several protests and some social debate about the security and about vaccines, and also if with this denial protest that COVID-19 doesn't exist and we don't have to use masks, and the states are oppressing our freedom. And we observed an impact, and this is the first thing I want to share with you. I mean, misinformation has an effect, and protest has an effect, and we were able to kind of measure this impact in our work, and so it's something that we have to worry about, how misinformation and conspirational thinking spreads in our societies. And the second point I want to share with you is this strong change that we had after the approval of the vaccines for the European Agency of Medicines, and the start of the vaccination campaign. And also a third factor is this third wave that we are suffering now in Spain, with increased perception of risk of the disease related to this new variant of the virus. So these three factors, so it's the approval of the vaccines, actually the starting of the vaccination campaign with some pictures in the media of older citizens in being vaccinated, and the increasing risk perception of the risk of the illness has very much boosted this recovery of the trust in vaccination. The second point I want to share with you is that this recovery is happening in most of the global north. I want very much to engage with Karsten after the presentation, because I think it's very much necessary to discuss the similarities and the differences between the perspective in the global north and the global south. But one thing is that we are in most global north countries, we are concerned about vaccination hesitancy, and we are measuring it, and we are taking some time and resources to do campaigns against it. And we are measuring that this hesitancy is declining in some countries faster than others. And especially if you can see here, Spain is one of the countries that is declining fastest, because we already had some lower levels of vaccination hesitancy previous to the pandemic. And here I want to, the third aspect I want to show you is this effect of the protest and misinformation that we mentioned before. Very briefly to present you these models, and actually we are trying to prove that they had an impact. And this is very serious because actually misinformation is affecting democracy and the way we are taking decisions individually and socially. And maybe we can discuss about it later. And in my experience is that we are reproducing and amplifying previous concerns with this pandemic. So as Karsten said, this is not, there are few new process going on. We are kind of reproducing inequalities and concerns that we had before the pandemic. And one of these concerns is the political polarization that we are having in Spain and in other countries, such as the United States or Brazil. And in this context, vaccination has become a weapon, a political weapon, and different parties are using how the strategy, even the science in the political arena. So in my opinion, this is quite serious and problematic. In this group of experts that we are around 30 individuals in this designing the strategy for the Spanish government for vaccination. We are just designing, they decide how to implement it. One main axis, the very first axis is bioethics. And this means that people who are most in risk of death, if they get the coronavirus, they have to be first in getting the vaccination. And we have tensions between different professional lobbies who said that our people has a lot of risk because they are very exposed. Different professions in the health system and also in the security system, and different professions. And also we have tensions because Spain is a quite decentralized political system, quite federal system, and we have tensions in how decisions are taken. I'm coming back to this reflection that we mentioned before. I mentioned before, and Karsten mentioned also, that the pandemic is reproducing these tensions and amplifying some of these tensions. And as a result of that, we have, I think, increasing erosion of social trust in political system and also in health institutions, which is quite important concern, in my opinion. And also we are seeing how political leaders are becoming cognitive shortcuts. Vaccination and pandemics are a complex issue, and individuals tend to trust their political leaders. If I do support one political party, it's very important for me in this situation of uncertainty and risk to listen which is his opinion. And here I'm concerned about some positions, particularly in the far right, where leaders are trying to put in question the existence of the virus and the necessity of the mask and so on. And this, finally, this is my last conclusion. This mistrust on the political system somehow is transferred to the scientific institutions, to the scientific advisors, the World Health Organization, and the managers of the health system, which in this situation it's a problem, a serious problem, because people has to, without trust, they won't collaborate, and without collaboration, we are not going to get out of this situation. Concerns in Spain and in European countries in general is that we don't have vaccines fast enough as we would like. When we compare us with the perspective that Karsten said, of course, here we can observe a privilege. We can observe a different position, geopolitical influence, and also I have the impression that countries have become more close, more national or nationalistic oriented, and we are forgetting that we are interconnected. We are forgetting what Karsten said, that without a global vaccination, the virus is going to mutate. So even from a national point of view, we would very much interested in a global and more democratic access to the vaccine, but we don't have. And finally, I'm also concerned about the quality of the democratic access in our countries. In the global north, we have the discourse that our access is going to be ethical, is going to be democratic. We are going to prioritize the more vulnerable groups. But in the reality, I'm convinced that in the next months, we are going to have social strong debates, how our institutions are getting away from this ideal ethical access, how inequalities are still reproducing. We see how we have already packages for entrepreneurs that are going to travel to Dubai to get the vaccine and to stay 3 weeks there for the second dose. So I think we have a very nice discourse in the global north. I think we are trying to implement a democratic access, but we are going to be measured for this deviation from the ethical perspective, and also from our inequalities with respect to the global south. And I finish here. Thank you very much.
Thank you, Josep, and thanks to both of you again. So as we go forward, we have 25 minutes, so lots of time for discussion. I do have lots of questions that I can ask, so there won't be dead time, but I'm saying that partly to encourage everyone else to think of questions. And I'd say there's really two ways for anyone else to put a question into the conversation. One is to type the question in the chat, and I'll be keeping an eye on that, and I can ask it for you, and that's fine. The other way is if you'd like to speak yourself, you can raise your hand. So on the reaction button at the bottom, if you click on the reaction, you'll see one option is to raise your hand, and we'll keep an eye on that and ask you to speak if you'd like to do that. But so while everyone who's listening is thinking of questions to ask, I'll start with the obvious kind of contrast. I mean, if someone didn't know anything about this, but just listened to both of you speak, it would sound as if in the global South, there's way too little supply, dramatically too little supply of vaccines. And so many people who want them aren't going to get them. And in the global North, there's a bunch of people who don't want them. And part of the reason, so that's vaccine hesitant people who are skeptical. And part of the reason in the global North is that there is some intentional misinformation, weaponization for partisan political reasons. But I have the feeling you're both going to say, yeah, but there's some truth to the other picture in the other part of the world. That, in other words, that there's short supply in the North and hesitancy in the South. You just didn't talk about it as much. So that's my question. I mean, to what extent is the problems of the South to be found in the North and vice versa? If either of you would like to address that.
Yes, thanks, Peter. I think I can go first if that's okay for you, Josep. As I was listening to Josep speak about this, I was thinking to myself as well, because as you say, Peter, the easiest thing is to assume that that these things are cast in stone, but actually they are not, and the situation is much more fluid than probably our presentations presented. Because you do have, so two things that I would like to speak about. So firstly is that when Josep speaks about mistrust in science, in politicians, I also want to make the assertion that there is mistrust in science as well. So the mistrust is not only limited to politicians, but it is linked to science as well. And the reason for this is not very complicated to understand. The reason is because science has not been an innocent bystander in the history and social realities of people in the global South. So when we think about the hesitancy and all the conspiracy theories, and unfortunately, yes, they do reach this part of the world as well. So whatever polarization, whatever hesitancy linked to the veracity, to the efficiency or efficacy of the vaccine, it is reaching all parts of the world. And I think as we reflect on it, we need to be open to that as well. Science has been implicated in a lot of the history, at least of the continent of Africa. I have, as Peter did mention, written about what I termed medical colonialism, to see how science has been misused by people, because unfortunately at the end of the day the scientists are human beings, so it has been misused by people for very particular reasons that are linked to the colonial history of the continent. And so I think we see the reproduction of the same kind of thinking and the same lived experiences of people who have gone through clinical trials without actually knowing what was happening, because someone just came to them and asked them to sign a piece of paper. So all of these things have happened, and I think they are contributing to the hesitancy as well, and to the misperception, or the current perception, at least, because it is the reality of people, the perception that people have of science and vaccines in the pandemic.
Sorry, and that means that some people, I mean, in practical terms, that means some people won't take the vaccine even though they could. Is that fair to conclude? Some people in, say, South Africa or Zimbabwe or many other countries will actually be resistant to taking the vaccine.
Of course, and I think the conclusion for this, for me, comes from the fact that, I mean, we already have vaccines for many other diseases, whether you talk about polio or TB or whatever else, and there is hesitancy for those very long, at least very old vaccines in that sense. So it is not surprising that for a new vaccine, people would be actually much more suspicious. So yes, I would agree with you that there will be hesitancy. Even if the vaccine were to be available, some people would not be interested at all in taking it.
Right. Just wanted to play that out to the end. And then, so Josep, on the in a way, you didn't talk as much about a little bit, but as much about lack of supply. But I mean, I was in a community conversation yesterday in the city of Chelsea, Massachusetts, which is one of the, I think it's the poorest city in Massachusetts. And most of the conversation there was not about hesitancy. It was about that they didn't think they'd get it. And there's in fact no availability of the vaccine in Chelsea physically. You have to go quite far. So it make, you could say it's the global South in Boston, and I think that's sort of true. But would you want to address a little bit the sort of supply problem in the global North?
Sure. Yes, I was mainly focused on hesitancy because without actually putting the vaccine doesn't work. So, but also we need to access to the vaccines, and this is, as you said, this is a serious concern that we have here in Spain, as in other countries. Pfizer and AstraZeneca, they are reducing the supplies that they promised for this month, and actually we have strong concerns about that. My main concern about access is that with these limited resources that we have, ethical and democratic issues are central, and I don't know how we are going to respond in our countries. I don't know to which extent we are going to prioritize these vulnerable groups first, and to which extent our privileged groups are going to access first. I'm sure that in the global south also privileged groups and leaders are, while we are speaking, they are trying to getting access to the vaccines. So in one sense, we are not two independent worlds. We are very much connected, but it's important to know that inequalities are much stronger in the global south, and the global north has a responsibility on that. And also it's important to know that the well-being of citizens in the global south is also in our benefit as citizens in the global north. We cannot understand ourselves isolated when we are living in maybe the first global crisis, but not the last one. And I'm also concerned that the mechanisms we are implementing in our domestic strategies, but also in the global strategy, how to address, I'm concerned that it's going to be very much important for the next crisis that we are going to face. And maybe this one is not the most critical. And so that's why it's so important to strengthen this ethical and democratic struggle, these aspects in our struggle here.
That actually leads to the next question I'd like to ask, which is about potential positives here. And if you think there aren't any, that's okay. That's a legitimate answer. But I do want to ask about it. So, and I can think of two kinds of positives. One would be examples of institutions doing a good job anywhere. I'm particularly interested actually in the global south, but anywhere, particular governments or other institutions doing a good job. The other, though, is the potential for political change, for social movements to be mobilized or more effective as a result of this pandemic. I mean, Josep, you made a point really following on what Karsten had said. I hadn't thought about it before, though, which is that we are at risk if the vaccine is not delivered in the global south for multiple years. And so that's, of course, an organizing opening too. I mean, that's potentially a political, there's a political agenda behind that somebody could move on. I don't know if anyone will. So what I'm asking is anybody doing a good job with this? Either a person with an institution with power, a government, for example, or a social movement that's not so much solving the problem, but doing a better job of raising the problem and critiquing the status quo. So either of you have examples of good things that are happening.
Thanks, Peter. It's very difficult, but also very important to talk about the positives at a time like this, because yes, it is very difficult to think about them. But yes, of course, I think we have noted some positives, and maybe to start with social change. I think that one of the positives from the pandemic is that it has forced many of us who were previously unaware of global health issues and access to healthcare issues and how vaccine development, research and production, how all of these things work, because they were not of interest to us. We could afford to go forward with our lives without really reflecting on these questions. And I think that now, because the pandemic has forced all of us to stop with our normal lives and pay attention to it. So I think I can only hope that one of the positives that at least can be sustained is the knowledge and interest that people currently have on global health issues, on the landscape of healthcare, on primary access to primary healthcare, and all of these questions. I think also interestingly, because we are suddenly faced with a global pandemic, it has also forced us to think about equity. So it has forced us within all of our societies to think actually who is the most vulnerable from all of us, whether or not actually in the end they will get preferential vaccines, as Josep was saying. I think that's another question. But I think the awareness that actually society is not structured as a monolith, but actually we are made up of so many parts, and many people in our own societies are vulnerable. And I think that the way that the pandemic has exposed that, for me at least, is a positive. Only of course if we are able to sustain it going forward, and we continue to use that same lens to question many of the global decisions that are made, global policy decisions at least. And for institutions, I think it's a bit of a difficult one, but I think if I were to be the Director General of the WHO, I think I would have a lot of questions coming my way. I think that, of course, we do need to think about the next crisis, the next epidemic. And I think that the WHO finds itself in a very difficult position going forward, because unfortunately they don't have the means to be able to put their mouth where their money where their mouth is, basically. So I think we have some reflections to have. What has been interesting in the Global South has been the grassroots civil society organizations that have been raising a lot of awareness on the big picture issues of access to vaccines. And now, I mean, at least in my part of the world, one of the most topical issues is on vaccine nationalism, as we call it, how certain parts of the world are hoarding the vaccine and keeping it to themselves. And it is forcing many people to actually, through the civil society organizations who are taking time to explain to people how the systems work. So I think that has been quite a positive, and that we will carry to the next, at least, global health crisis. Because at the end of the day, really what we have to consider, at least especially for access to healthcare and pandemics and epidemics, is that the most legitimate people come from the societies where people are. So it is much easier, of course, to have conspiracy theories about big pharmaceutical companies and big governments and Western governments and all of this. But it is much more difficult to sustain a conspiracy theory about your neighbor who lives down the road and all of this. So we need to factor that in. And I think we are seeing some of the positives. It does matter who passes a message more than what the message is. So we need to factor that in. And I hope it's one of the positives that we carry forward.
Thank you. And can I vote for you for Director General of the WHO? Are you running for office?
No,
I don't think
no, thank you.
Josep, did you want to address the positives?
Yes, thank you. I'm very much agree with, we are facing a structure of opportunity for good change and for social movements. But I'm not very optimistic. I'm sorry. I would like to be, but one of the things I'm surprised during this pandemic is the strength of institutions, how they react, and the state is able to lock down cities and population during months. And the second thing is that the institutions are very slow. they have a lot of inertia, and they don't adapt fast enough. And also social movements. I think social movements are also in shock because the society is in shock, and we are in this situation. Everything is possible. Also, the light, the rationality, the values of equality, and hopefully social movements are going to be that way. But also the opposite, and misinformation and protests based on misinformation and nationalist concerns and fears. So I think it's like we are seeing slowly how these things are developing, and hopefully we can introduce some interesting reflections and collectively in the society some information, some light to go in the line of the reason and equality. And our social movements in the North are going to be collaborating with the Global South movements, and we hopefully build a more ethical and democratic societies. Let's hope.
No, I don't blame you for not being more optimistic. You just have to be realistic. I wanted to ask the positive question to make sure that you had a chance to, you had enough time to answer it, but I will go back to more negatives because there's lots of negatives to talk about. So, I mean, another question, maybe this will be our last or close to last, is what should we be worried about in terms of the long-term social and economic consequences? I mean, I wrote an email to these guys with some questions, and I said something about, 2022, but listening to Karsten, I realized we may be talking about 2023, 2024. So what's the, so some of the things that I naively worry about, and I'm not an expert on this, but are, loss of schooling years for large numbers of kids. And especially not just the individual effect, but the comparative or competitive effect. So what happens if Kenya's schools are closed? I think the entire country's schools are closed, and they're not closed in really in America. So what are the competitive effects? So, but anyway, I'm beginning to answer the question. I really want to ask it, which is what should we be worrying about here in terms of the social, economic, beyond just the individual person who's sick or dies, but what are the social effects of this pandemic that we should be worrying about?
Thanks, Peter. It's a very difficult question to answer because it does require one to open up their mind and be very imaginative, because it's quite a big scope. But I think for me, some of the things that come very quickly to mind is maybe we talk about the pandemic, but then we can talk about the broader aspect of healthcare. So we can imagine the number of people who today do not have access to sexual and reproductive health because the local clinics is closed because all the health staff are affected by COVID, and the health structure has to close, or they don't have PPE. So we can imagine what the impact of that is. We can imagine the lack of access to family planning services. We imagine the lack of access to very regular medication for chronic illnesses, for example, the number of people with diabetes, with hypertension, with various forms of cancer, and what this will mean for the health system, for the healthcare system that is already quite stretched during the pandemic. But after this, they have to unfortunately catch up with all the missed vaccination campaigns that should have been taking place by now. All the people who are denied access because they are in conflict areas, for example. So all, unfortunately, the net effect for me is that the pandemic will unfortunately just multiply the current global inequalities that we see when one part of the world has no access to education because it is not possible to have a class on Zoom like we are having this discussion today. What does it mean for the students who are not able to write their final examinations to go into college or something? So the impact is quite big from a socio-economic perspective, and I don't think that at the moment we are paying sufficient attention to it to be able to, because when hopefully however long a time it takes, whether it's 2024 or whenever, But at some point, we are going to try to rebuild what we lost in the years that have passed. So I think that what we could do is to start thinking about these things today, at least for the policymakers, to start thinking about them so that when the moment actually comes, we don't lose some more time, or after already losing quite a lot of time, trying to reimagine how we can rebuild. So I think we have a lot of work to do in that sense. Yeah, ahead of the end of the pandemic.
Yep, that's what I'm hoping we would be thinking about. I think, Josep, this will be your last word, because we just have a few more minutes. So any thoughts about that question? What social consequences we should worry about?
No, I think Karsten already said it's a global, it's a total phenomenon. I mean, the pandemic it's affecting every dimension of our lives. And I think in every discipline, professionals and academics are underlying which are the effects that we are living in our society. Only I would like to stress the issues in mental health. People is becoming isolated during the lockdowns and during the pandemic. It's lasting several months, and also the loss of weak ties, and people is getting feeling alone and being actually alone, and there are more groups, they are more especially vulnerable to this situation. But the effects are in other dimensions of our lives, and this is my last word. I think it's not very positive, but yeah, I don't know.
No,
I'd like to finish with another subject or another topic, but yeah, the effects are innumerable. I mean, we cannot just identify all of them.
No, I appreciate everything you said, and you didn't have to add down a positive, because that wouldn't really be true. But we injected a bit of the positive in the middle. So I think we should, Susan, we'll wrap up, right? I think it's coming to the end. Do you have anything to say to close us out? I just want to thank Karsten and Josep for disturbing but very valuable and thoughtful contributions. So I'll turn it back over to you, maybe, Susan.
Thank you, Peter. Just the same, I'd want to thank you, Karsten, so much, and Josep. It's really raising a lot of issues to give us a lot to think about geopolitically and medically in terms of public health. A really, really important discussion. Thank you so much. And thank you, Peter, for moderating, and thanks to all of our participants. It was really great to see so many people come out today. And I look forward to next month, where we will be presenting another panel on digital speech, disinformation and censorship, social media and democracy. So you'll hear more from us about that. Thank you. Thank you so much.
Thank you.
Thank you so much. Thank you, Susan. Thanks, Peter. And thanks to Josep.